I thought it would be useful to go through what you are likely to find in a bleed kit. There are more and more of these around, and they are for the treatment of severe, catastrophic, life-threatening bleeding. So if you are faced with something like that, it's really important that you know what is likely to be in this piece of kit. So here is an example, and I will also show you some alternative types of content that you might find in there. Okay, so first of all, what is a catastrophic or life-threatening bleed? It is a bleed which direct pressure is unable to stop the bleeding. At that point, that is the priority over anything else. They are likely to bleed out very, very quickly, and then they won't be able to be saved. So you have to act super fast to stop that bleeding before it kills them. So key thing is, anyone that is bleeding a lot is likely to go into shock. Shock is made worse when someone is cold and wet. So keep them warm and dry as warm and dry as you possibly can, and stop the bleeding fast. So inside this kit, you will find a foil blanket. That's not your absolute priority, but it's important for the end. Or if somebody else is able to help, then they can be wrapping them and keeping them warm. Lie them down, elevate the legs. That will all help to treat shock. I've got separate information about shock. This is about saving their life. More importantly, you need to find what is likely to be able to stop that bleeding fast. And it depends on the type of wound. So apologies if you're a bit queasy. We've got different wounds sort of illustrated here. We've got stab wounds. We've got an in wound, potentially from a bullet, and the external wound, which is generally a lot messier if the bullet's passed all the way through. You've got a sort of trauma wound, which will need packing, which is something like a sort of severe road accident or something like that, when something's caught and dragged and stuff. If there is a lot of blood coming out of a gaping wound, like one of these, and direct pressure will not be able to stop it, then what you need to do is pack that wound. And inside your bleed kit, you will have something called Celox or Chitta gauze or something like that, which is in a little compressed bandage type pack. And inside there, you will have stuff which is coated with a clotting agent. And what you need to do is to find the source of the wound and pack it in firmly to stop the bleeding. And this clotting agent will help to clot that wound and make it seal as quickly as you possibly can. So other really important thing, put on gloves. There will be gloves in your bleed kit. Put your gloves on. Blood is not nice, and it can lead to infection. Put on your gloves. Put on your gloves and stop that bleeding fast. So you put on your glove, you stick your finger in and you find the source of the bleeding. You grab your gauze, you rip it open, and inside you are likely to find that it is Z-folded up like that. So it is Z-folded gauze. That is the easiest to use, and most of them are folded like that. That means that when you are packing into the wound, you can use your finger, find the source of it, and you can then pack on top of it, applying pressure as you go to fill up that hole, so that when you have filled it up, it's nearly there. So obviously you would be doing this with more pressure, and you would be looking at what you are doing as well, rather than me trying to do it while I'm explaining to you. And you would put it on. The gauze that you would use doesn't have a pad on. I'm just demonstrating with a dressing. And you would put it in like this, and then you would apply pressure, and hopefully that will help to stop the bleeding. So you apply pressure like that. Somebody else can hold it, that's even better. And then in here, you should find a trauma dressing. So a trauma dressing is like one of the standard dressings that you might be used to in a first aid kit, but it is thicker, it is stronger, it will have a bigger pad, and it will have stretch to it to enable you to put traction on and apply the pressure you need whilst you are to stop the bleeding. So one like this sort of trauma dressing will have a nice neat pad on. You don't touch the pad, you have your gloves on, but you're not going to touch the pad. You put the pad over the top of the wound. If you do need to pack it, then you put it over the top of the packing. If you haven't needed to pack it, you just put it straight over the wound to stop the bleeding. And you apply pressure, and you are going to be pulling and wrapping it over. So here is an alternative version. So some of them have an adhesive strip at the end that you just peel off and you can stick to stick it together. Some of them have Velcro, and this one is an emergency bandage. They all arrive vacuum packed so that they are small and fit neatly into a kit. So you might initially not think you're getting much in your kit, much for your money, but actually all this stuff is really expensive kit, and it's vacuum packed in, and it's there to save someone's life. So on one of these sort of dressings, you've got a bar on there which allows you to give even more traction as you go through. So you've got a big strong pad, you hold it both ends either side of the pad so you don't need to touch the pad. You put it over the wound and you stretch it round. So you stretch it round, and then in this particular one you put it through the bar. There's different ways of using it. You can put it through the bar and go back on itself, and that can increase the traction that you put on it. And you can also do an added twist on there every time you go over the bar, that again will increase the amount of pressure that you are putting on and across the wound. So you would just twist as you go over. You need to make sure you go above and below the pad as well, so that no stuff and debris can get in. These are all used in battle, so these are designed as battle dressings for you. So you need to go over like that, and when you get to the end of this particular one, you have a bar, and that bar can then be hooked over a couple of bits of the dressing, and then they can be secured. They just clip over through a couple of pieces of dressing and clip down to clip it in place. You can also use the bar to tighten even further if you need a sort of tourniquet option, but it isn't as strong and won't generate as much force as a full tourniquet. So you would secure it like that. So that would be a firm pressure dressing. If the blood comes through that, you would apply another dressing on top. If it comes through both, then you might have to take everything off and check that you've actually stopped the source of the bleeding and actually got in. But hopefully, if you've packed the wound, the Celox will start to work as well, and that will be stopping the blood loss too. So that is applying a trauma dressing. You also might have a Russell chest seal in there. So that is used if you have what's known as a sucking chest wound. So if you have a wound to the chest wall and it has penetrated sufficiently to go through the chest wall and through to the lung, then it can cause the lung on the affected side to collapse. It's because of the lack of air and the lack of positive pressure. Now, previously, people used to say, get a plastic bag or something and seal on 3 sides and stick that on there, lean the person slightly to the affected side, and that's a good thing to do. That is no longer recommended, because what can happen is if that seals in too tight, it can affect the pressure, and it can cause what's known as a mediastinal shift, which is when, because of the pressure created within there, it can cause the heart and the trachea and the lungs to all move over, which is very severe. We do not want to make things worse in first aid. This is not recommended anymore. So whatever you read in the old stuff, no longer lots of sticky tape on the sides like that. If you have a proper patented chest seal that will reinforce, it will restore the pressure within the lung and allow the affected lung to inflate, then you would use this. You rip it open. It is made of very special hydrocolloid dressing. It's see-through. You can see where to place it. It's very simple. You peel off the outside, stick it on all the way around, and what it does is, because it's got 4 holes in it, it will restore the pressure they've got valves in them, and it will allow the affected lung to reinflate. So really, really important. So if you've got one of those, that is ideal. That will potentially allow their affected lung to reinflate. It will also allow blood and air to escape from there. So don't worry that there is blood potentially coming out as well. If you haven't got a chest seal, then the advice is to leave the wound open. So I know that's counterintuitive. If somebody has what's known as a sucking chest wound, leave it open and lean the person slightly to the affected side and get help fast. Okay, the other thing that is likely to be in your bleed kit is a tourniquet. So I have far more detailed information about how to apply a tourniquet, but basically what you are doing is trying to cut off the blood to the affected limb, because you are pouring blood out here. You need to stop it coming out. And lots of people are worried that, that you're going to lose your leg because you put a tourniquet on it, or lose your arm if you put a tourniquet on it. No, that's not the case. The tourniquet will not and should not cause any further damage or problems. But once you have made the decision to put a tourniquet on, you do not remove it. It will be incredibly painful for the person. It is saving their life. Once you have made the decision to put it on, the only person that removes that tourniquet is a clinician with the correct support, usually in a hospital environment. So do not let anybody else release it and reapply it or fiddle around with it. If the bleeding doesn't stop, you would put another one above it. So once the decision is made that you're going to use a tourniquet, you put it on, you put it up and above the wound. So you're putting it above the wound here. You pull it tight. So you're putting it about 5 to 6 centimeters above the wound, because sometimes the wound can actually, the blood vessels can contract back up. So you want to make sure that you are pulling tight enough. You pull it tightly round with the Velcro, like that. And then there is this windlass here that you would twist. So you twist, 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 and then you tuck it in under here. You write the time that you applied it, and you make sure that you tell the emergency services that there is a tourniquet applied. You leave it visible. The person will be shouting out in agony when you're applying this. It is painful to apply. It is saving their life. And again, to reiterate, nobody is to remove this tourniquet once it has been applied. I have lots more detailed stuff about all these individual catastrophic bleeding dressings and things on my site. I also have it covered in our online course, and we can run practical courses where we will come along and show you exactly what to do and bring along all the kit so that you can have a go. So I hope this has been useful. I hope it hasn't scared you. These bleeding kits are really, really useful. They are available in many places alongside a defibrillator, and they are there to save someone's life. So please watch this. I hope it's useful, and I hope it gives you the information you need to feel confident using it. Many thanks. That's Emma Hammett from First Aid for Life and onlinefirstaid.com.